Hi everyone. So, quite frequently in children, we have this situation arising wherein their front teeth are missing. So, before we actually dive into what we're supposed to do when that happens, we need to understand that why does this happen? So, the most common reason as to why the missing teeth and specifically the front teeth of children go missing is that the ectopic eruption of the front teeth. Ectopic eruption, that means the front tooth or teeth is erupting in an abnormal position, as you can see in the picture that I've attached onto the screen. Now, when that happens, that puts undue pressure on the tooth that is just near to the ectopically erupting tooth, and that causes the falling off of that tooth. Now, if that happens in the front region, if the, let's say, most commonly when the permanent incisors are erupting in an abnormal position, they will apply undue force on the milk tooth that is already there, and the milk teeth or the milk tooth falls, and that leads to the situation that can be seen on the screen wherein you have the front teeth missing. Then the second situation can be because of trauma, because we see children usually are running and they're actively involved in sports, and otherwise also because of their activity they tend to have falling, specifically the anterior teeth and more specifically the upper front teeth, that means. So yes, trauma is also a reason for their missing front teeth. Then advanced caries. If you've seen my video of early childhood caries, ECC, I'll put the link in the description box also. That is also a reason of missing anterior teeth or missing front teeth. So advanced caries, so that needs to be taken care of. See, why knowing the reason is important is because the treatment will depend upon the reason. Okay, and then extraction of neonatal teeth. That means if a child is born with tooth, because the first set of teeth erupts after 6 months, usually after 6 months of birth. But if you have a child born with the front tooth or teeth, then in that situation, if you extract that neonatal teeth, in that case also, usually this neonatal tooth is extra, but sometimes it is also from the set of milk tooth. Now, if it's from the set of milk tooth, then in that case, you're taking it out because it is causing injury to the tongue and all. And if it is taken out, if it is extracted, then in that case, its permanent successor, that means its permanent counterpart, that means its permanent incisor that is just below this tooth, that is going to erupt late. Why it's going to erupt late, we'll get to know later. Then, so these were the main reasons because of which we have the front teeth missing in children or otherwise also. Now, before I head into the treatment part, there's one important thing that needs to be understood. So there's one important point, and that is whenever you have the upper milk front teeth or tooth missing, and if that missing is happening after the primary canines or the milk canine teeth have erupted into occlusion, that means they have erupted into biting position, that means they have completely erupted at approximately 2 years of age. So if that loss of upper, or let's say upper itself here, upper front teeth, if that loss of upper front teeth or tooth has happened after the milk canine tooth or teeth has stabilized, that means it's usually by the age of 2 years, then the intercanine width will not decrease. I'll show you what intercanine width means. That means the width between the two canines on either side. So that space is not going to decrease because the canine, especially the upper canines, they are held in position by the lower canines. They are locked by the lower canines. See, over here. This is the intercanine width which is shown on the screen. This width is stable after the primary canine or the milk canine teeth have erupted fully. That means when the child is 2 years of age. If it is happening so that the front upper teeth, milk teeth, that means, have been lost after this stabilization has happened, that means after 2 years of age, this space, that means the space of primary incisors, will not be lost. But if it happens before that, then in that case we need to maintain the space. We need to use a device, that means we need to use a space maintainer so that that space is not reduced, because we need to maintain that space to accommodate even larger permanent front teeth that are going to come at their places. Okay. Now what happens if we do not treat this missing front teeth? Then in that case, there will be delayed eruption. Okay, delayed eruption of the permanent incisor that is going to come at its place, because the connective tissue and the bone that is there, this is anyways going to become harder and harder and is going to disrupt or stop the eruption of permanent incisors. See, even if you intervene and treat, okay, even in that case, there is anyways going to be a slightly delayed eruption of the permanent successors, but you can shorten the period of being delayed by intervening. Then, unattractive appearance, obviously, because the upper front teeth, they form the smile line. And when they are missing, obviously they are going to affect the aesthetic appearance. Then, there is the potential development of deleterious habits. I have a complete and dedicated video on all kinds of oral habits. I will put the link in the description box. You can check that out. Habits like tongue thrust, swallowing, improper forward resting position of the tongue, all this can happen because you have the space in front and the tongue will try to fill that space. Then, the upper front teeth are also important in making proper fricative sounds. When those front teeth are missing, obviously you will have improper pronunciation of fricative sounds like S and F. And speech is very important, especially in such a young child who is still learning how to make proper pronunciation. So we cannot take this risk of having this development of improper pronunciation. Now we'll come on to treatment part. Now treatment can be done by removable approach or a fixed approach. If we go by the removable approach, we can have a removable partial denture. It will have clamps and all which will fix the removable plate, and it will have an artificial tooth at the place where the tooth is missing. Now this needs to be put, and it can be taken out at night. It can be taken out for cleaning. It should be in fact taken out for cleaning. So this replaces the missing front tooth, or whichever region the tooth is missing. You can put artificial tooth. You can put an artificial tooth in the removable plate and you can use it. The major disadvantage with this is the denture can get lost, obviously, when it's out of your mouth. It can get damaged, it can break, it can fall from your hand and break. Also, the cooperation of the child is very important, especially for a child who is so young at age. It's quite difficult for the child to, learn to how to put it on and take it off. And it's quite like, children are quite clumsy, so it will be difficult for the child. So cooperation is a very big factor with a removable partial denture that is replacing the front teeth. Then, if we go by the fixed option, then in that case, once it's put, it's easy. The child can, easily go about it. But the child needs to be really particular about the cleaning part. And for that, the parents have to be very meticulously cleaning the child's mouth. So in this kind of an option, what happens is you have crowns, and to those caps, that means those steel caps that you can see, those steel caps are actually put, and to those steel caps, we have a very thick wire that is soldered onto those caps. And then we have those artificial teeth that are attached to that wire, and it can be cemented onto the desired position. So this fixed option does not have this problem of getting lost or getting broken. Yes, it does get broken very rarely. So it can be again, can be corrected, can be uh, made again, or whatever is required, depends. So yes, that's it. These were the major things that were associated with when front teeth are missing. And I thought of covering this topic because it's really frequent these days to have this situation arising, and people usually end up not doing anything, thinking that, oh, its permanent counterpart is anyways going to come. No. You're supposed to intervene, you're supposed to take action accordingly, visit your pedodontist, and do things as they say. That's it for now. Do watch my related videos, it'll help you in understanding the things better. Till then, take care.